Hi, this is Connie Haxby, licensed clinical social worker. And in light of the recent tornadoes that we've experienced here in Nashville, I want to talk about the importance of getting treatment for traumatic events so that those don't, in essence, turn into post traumatic stress disorder. When we think about PTSD or post traumatic stress disorder, a lot of times we think of things like war veterans or victims of domestic or sexual violence. And pretty much any situation that you've been in that has been stress inducing can eventually turn into PTSD if it's severe enough. And again, the importance of getting treated for this early on, I can't state it enough, because what we don't want to see happen is folks to, deal with something, go into the shock of the aftermath of the experience, and then, suffer from all of the different types of things that we experience with PTSD, such as agitation, irritability, loneliness, feelings of grief, feelings of guilt. Sometimes we have flashbacks, sometimes nightmares, sometimes sadness, depression, and things of that nature. Hypersensitivity to things that remind us of the traumatic event. So, sometimes, when we're talking about things like experiences with tornado, something as simple as the time of day that it happened can be something that sends you back into that panic or that feeling of, oh my gosh, I'm unsafe, something's going to happen to me, I am in danger. And that's basically the body's response to what it thinks is a dangerous situation, when really it's just this discomfort that you're feeling based on the experience of what you felt back then, whenever the experience actually happened. And the reason that I bring up the importance of recognizing these symptoms is because we want to catch them early on. And early intervention is so important to making sure that this doesn't turn into something severe that you're dealing with, 2, 3, 4, 10 years down the road. So, what I really encourage folks to do is, if you were caught in the tornadoes and you have any sort of symptoms in which I just described that you're feeling and experiencing after the shock of this horrible situation, is I really encourage you to reach out. And what I'm doing for folks around the city for my own contribution purposes is, if you want to catch this early on, I am offering free sessions, up to 3 free sessions, for folks who have experienced this trauma, so that we can try to utilize some EMDR or some havening techniques, different types of therapies that have been proven to help with any sort of traumatic experiences. Again, the longer that this goes on, the worse that it can get, and the worse that it could be, for you, and harder to treat later on as well, because, right now, after it's happened, you haven't had months and sometimes years to kind of re-experience this trauma. And so it's just really important to try to catch it early on. So if you are interested in having any type of therapy to help you overcome the devastation and the loss that you experienced with the tornadoes, please reach out. My phone number is 502-439-5323. And again, I'm offering up to 3 free sessions. The reason that I say 3 is that when we get you in here and start working on these issues, it should take no longer than 3 sessions if we use the appropriate protocols to work on these things. And so I'm hoping, that some folks will come in and, see improvements even after 1 session. So again, it's, I'm located in Mount Juliet, Tennessee, where a lot of the destruction happened with the tornadoes. But if you are, any Tennessee resident in any outlying city, please feel free to reach out, and I will get you on the schedule. We'll get you in here. We'll work on those symptoms, and we'll make sure that you're in a better place than where you are right now experiencing these. I don't want to see you suffer months or years from now with the same, nightmares and hypervigilance to sound, or to time of day, or to things that you see and experience. So feel free to reach out, give me a call. We can answer any questions that you have prior to making an appointment if you like. Appointments are going to be typically about an hour long. And yeah, so let me know if you have any questions. You can also email me at Connie at Haxby, that's HAXBY, counseling.com. If you'd rather reach out to me that way as well, and we can talk about the treatment options that I can offer you to help you get through this time. Until then, take care of yourself. I'm glad that you're safe, and have a great day.